Now let's talk about speed and heart rate. It is quite important to know the different conduction speeds of certain parts of the heart since they determine normal heart rate. So we have the SA node, which is 60 to 100 beats per minute, the AV node, which is 40 to 60 beats per minute, bundle of His, between 25 to 40 beats per minute, and the bundle branches and Purkinje fibers at 25 to 40 beats per minute. Now, AV node is the slowest, so it has the most time to fill the ventricles with blood, while Purkinje fibers are the fastest. So the Purkinje fibers are faster than the atria, which are faster than the ventricles, which are faster than the AV node. A well-known mnemonic used here is the Park Adventure Avenue. Park for the Purkinje fibers, At for the atria, Venture for the ventricles, and Avenue for the AV node, to remember the fastest to slowest conductions. Now, the most common thing you'll be asked to do as a medical student, especially in your third-year clinical rotations, is to determine the heart rate by looking at an ECG. When looking at a typical ECG, there are two kinds of boxes you can see, big and small boxes. Now, one big box represents 200 milliseconds, and every big box contains 5 smaller boxes, each of which represents 40 milliseconds. Now you have to count every little box and then add them up to see how many milliseconds pass between the two QRS complexes and then calculate the heart rate. I know. Easy, right? I'm just kidding. No one really counts it that way. I mean, you could, but almost everyone uses a much quicker and easier method. By just counting how many big boxes pass between the two QRS complexes. Now, one box is equal to 300 beats per minute. 2 boxes is 150 beats per minute, and 3 boxes is 100 beats per minute. So basically, it's 300 divided by the number of boxes. The normal would be between 3 to 5 big boxes. Now, this is not a way to get the most accurate heart rate, but it is a quick way to assess if the heart rate lies within the normal range, which is 60 to 100 beats per minute. And that's how you calculate the heart rate using the ECG strip.